Many of us appreciate the occasional opportunity to disconnect, giving our minds and bodies a chance to recharge. But when isolation becomes long-term and turns into loneliness, the results can be detrimental and potentially devastating, particularly for aging adults. The number of Americans aged 65 and older is projected to nearly double from 52 million in 2018 to 95 million in 2060. And 65 and older age group share of the total population will rise from 16% to 23%. Also, the average US life expectancy will increase from 68 years in 1950 to almost 80 in 2017, in large part due to a reduction in mortality at older ages. These societal changes among aging Americans have led to isolation on a greater scale than in recent times. This is especially true in the rural Midwest, where small urban and rural communities continue to age disproportionately as younger populations move to larger communities, pursuing education, employment, and other opportunities. The current COVID-19 pandemic has also added to the level of social isolation among aging adults throughout the country. Improving mobility within the aging population in these smaller communities can aid in lessening isolation by allowing for greater opportunities to socialize and to move around one's community, resulting in decreased healthcare costs for everyone. My name is Del Peterson. I am Associate Research Fellow with the Upper Great Plains Transportation Institute at North Dakota State University, and this research compared the increased medical cost from isolation among aging adults to the cost of providing greater mobility options through demand response rural public transportation. And this is designed to lessen isolation costs. For example, as the degree of isolation increases among aging adults, Medicare costs tend to rise as well. By improving mobility options for isolated aging adults, this will lower their social isolation and also the medical cost due to decreased isolation levels. Comparing the costs associated with providing greater mobility to that of Medicare costs, both with and without greater mobility, will determine whether or not such action would make sense financially. Considerable uncertainty arises when comparing costs involved with medical and mobility options. Individuals must make complex, dynamic decisions pertaining to multiple choices available to them. Therefore, to explain some of this uncertainty that does occur, stochastic simulations were conducted. Medicare costs due to isolation were quantified from an AARP 2017 study that found an annual increase of $1,600 in Medicare costs for each socially isolated older adult in 2012 dollars. Isolation levels were quantified using a composite score of responses to target questions related to social isolation. All analysis used monthly costs per individual, so $134 per month was used for 100% low of increased medical costs due to specific isolation. This value was inflated to 2018 dollars to match the data from the Rural National Transit Database using the Consumer Price Index. 10 states were studied individually and also grouped together within the simulations. These included North Dakota, Idaho, New Mexico, Alabama, Arkansas, Kentucky, West Virginia, Vermont, South Carolina, and Nebraska. 4 key findings were found. Among them, rural transit agencies can cost effectively provide service to lower isolated related medical costs among aging adults. For example, based on isolation benefits alone, rural North Dakota transit agencies provide up to 9 demand transit rides per month to an isolated aging adult for less than the added medical costs of being isolated. These rides would allow the aging adult to visit friends and family, attend local functions, or participate in a variety of other activities within their local communities. This will lead to lower isolation medical and lesser medical costs. The second key finding was that the current COVID pandemic has increased isolation among aging adults, which will lead to greater social isolation and medical costs in the future. It's been found that social isolation is likely to become a major risk factor that affects adults' healthcare outcomes. Rural transit can lessen this increased isolation by increasing ridership among isolated aging adults. For example, based on the marketing to aging adult simulations in this research, the average small, medium, and large rural transit agency within the state's 10-state study region can cost effectively provide an additional 7 trips per month for isolated aging adult at the median level. A third key finding involved rural transit agencies' role to help lower medical costs through lessening isolation. It needs to be considered for Americans to live longer and demand greater mobility options. Average US life expectancy has increased, and Social Security and Medicare expenditures as a share of gross domestic product is growing. Rural transit will continue to play a considerable role in lessening these costs through added service as long as they are properly funded. A final key finding was that increased funding for rural transit will be necessary as rural communities continue to age. This is disproportionate with younger populations moving to larger communities. Transit will need to serve as a transportation lifeline for many aging adults whose support networks or friends and family no longer reside in their local community. Thank you for your time and have a nice day.